People in BC do not have equitable coverage to osteoporosis medication treatments as those in other parts of Canada. Providers who prescribe therapies to prevent fractures must spend time filling out forms and helping patients navigate coverage for treatment. We must take action to change this inequity.
I understand there are many options to treat people who have a high risk of bone fracture or osteoporosis. How does BC coverage compare to other provinces of Canada?
Osteoporosis treatments are more available in other provinces. Many of them have simpler criteria to access options for osteoporosis treatment. There are medications that can prevent fractures, that can be self-injected under the skin, as an intravenous once a year, or even other oral medications that are just easier to take. These are accessible in most other provinces with the simple criteria of being at high risk of fracture. The question is, why are BC patients being left behind? Why are BC patients not receiving equitable access to these important preventive medications like other Canadians?
Aren't there other conditions where a person at risk of an adverse health event gets preventative therapy covered?
Some good examples of this are people who are at high risk of stroke with high blood pressure. They have several blood pressure medications without any paperwork required by the care provider. Patients with diabetes can also receive a variety of treatments to control blood sugar that are publicly funded without any paperwork. In contrast, patients with osteoporosis without a fracture have no options for pharmacare-covered treatment, even if they are at high risk of fracture.